We have developed this video in order to explain some important features of the virtual ER interface. We have developed a tool called the virtual ER. It is our hope that the virtual ER can help us better understand emergency physician departmental level cognitive tasks and management strategies. This study in particular was evaluating MD workload perceptions in the ER. We're using the virtual ER to help us to present a series of sequential departmental scenarios which will then be evaluated by yourself. Some of these scenarios may appear typical, others may be on the more extreme side of things. A whole spectrum of scenarios will be presented to you. In order for you to effectively evaluate these situations and the scenarios presented, you must feel comfortable using our virtual ER interface. The interface itself is designed to be similar to that found at Hamilton Health Sciences and at St. Joseph's Hospital in Hamilton. But there are some important differences which I will explain in this video. This screen presents to you the basic interface of the virtual ER. As you can see, it appears like a typical tracker board that you would find at HHS or at St. Joseph's in Hamilton. The column on the far left lists the patient's room. The rooms labeled CC correspond with critical care. The OBS rooms correspond to intermediate level care, and the RAS rooms correspond to minor level care. For the purposes of this study, assume that the major, intermediate, and minor level care rooms correspond to those which are found at HHS and St. Joe's. Next, you'll see a column with the patient's name, which is self-explanatory, and the patient's given CTAS score, followed by their age. Next, there is a column listing the particular EDIS complaint for that particular patient. And then you'll see a column listing tests. This is where any investigations which have been ordered will appear in regards to if they have come back yet, if they're pending. Any new results will appear as new results in yellow. Any pending results will appear blue and list pending. If the label is blank, that means that no tests have been ordered for that particular patient. The next column lists the status of the patient. This is whether the patient has been seen or is under a consult service, or as in the case of this tracker board, the patients are waiting to be seen in green. If purple, it means they've been seen by an MD. If red, they're up for reassessment, or the patient may be accepted by another consult service, or the consult might be pending. You'll notice that these two columns list drop-down menus, which you can change. You can change them in this study. However, it will not have any effect on the scenario itself, as this feature has been disabled. The next column lists the time that the patient has been in the department, followed by the most responsible physician under the MD column. If a patient's MD is listed as MRP, that means that no physician has signed up for that patient as of yet. The last column on the far right lists a series of buttons called Open Chart. If you click the Open Chart button, it will open that given patient's chart, and you'll see a sub-window opens on the far right. At the top of the chart lists the basic demographics of the patient, followed by any allergies, past medical history, or medications that they may be on. At the bottom of the screen, you'll see a listing of the patient's most recent vitals, followed by a triage report. Between the top of the screen and the bottom of the screen are three important buttons. Here you will see any previous labs that the patient may have on our virtual ER computer system, or any past ECGs or previous imaging. Not all patients will have data, just like in real life. However, if the patient does have data, by clicking the given button, you will open a new sub-window which will list the previous labs, ECGs, imaging, etc. When you're done viewing the imaging or labs, etc., just click to close that given window to go back to the main interface. For the purposes of this study, I hope that you can fully evaluate the scenario that is presented to you from the perspective that you are coming on a new shift. I'd like you to evaluate the situation from a perspective of how difficult is it? How demanding is that given situation? Is it frustrating? Do you think it will be very time consuming? Or do you think it's cognitively demanding? Keep these aspects in the back of your mind and flip through the charts as much as you feel you need to. Look at the board for as long as you feel you need to. And when you are ready, click the End Scenario button. After you click the End Scenario button, it will open a new window. On this window, you'll see a listing of various aspects of demand. Here, I hope that you can rate these different aspects on this given chart. You do this by just clicking the buttons. And please note that we're asking you to rate your perceived mental demand. Of course, you're not going to run through that particular scenario to its completion. I'm asking you to estimate how demanding you think it will be. At the bottom, there is a comment box. Here you can type any comments you may have. In this box, it would be very useful if you can list rationale of why you scored a particular scenario the way you did. If you feel you need to go back and re-review the scenario, there's a link at the top of the chart which you can click to go back to that scenario. When you are done your ranking of that scenario, please just click the red button at the bottom of the chart labeled Next Scenario, and that will load up the next scenario for you to review. That is about everything you need to know in order to comfortably navigate the virtual ER. I hope you find your participation in this study interesting, and I thank you very much for your time. It is very much appreciated.